If you're a parent, you know. There are few things more stressful than when your child is uncomfortable. And when it comes to tummy troubles, man, the worry can feel constant. So let's dive into this and get some real clarity on one of the most common challenges of being a parent.
This is it, right? This is the question that keeps so many of us up at night. You see the fussing, you hear the complaints, and you just can't help but wonder, is this just a normal kid thing, or is it something more? It's a question every parent asks, and today we're going to get you some answers.
Okay, so first things first, take a deep breath. You are so not alone in this. Digestive issues are a super common part of childhood. Seriously, they can pop up and affect everything from mealtime to their mood, but the big thing to remember is they're common and almost always they're manageable.
To really get a handle on this, we've got to move past that vague general worry and start looking for clear, specific signs. So let's break down what you might actually be seeing at home, turning that worry into something you can actually work with.
And you know, these things can show up in so many different ways. We're talking about everything from reflux, that classic baby spit up, to constipation that makes going to the potty a real struggle, or maybe it's frequent stomach aches and bloating. Sometimes it even looks like your kiddo's suddenly becoming a super picky eater, or just losing their appetite altogether. These are all potential signals their tummy is trying to send.
All right, so you've spotted a symptom. Now comes the next big question. Is this call the doctor worthy? This next part is all about giving you a clear, calm checklist so you can make that decision with confidence and hopefully get some peace of mind.
The key word to look for here isn't about a single bad day. It's all about patterns and how severe it is. See the words here? Persistent, more than a few days, longer than 48 hours. One weird day is usually just that, one weird day. But when these problems stick around, or if you see something more alarming, like your child isn't gaining weight, you see blood, or they just seem wiped out all the time, that's your signal. That's your cue to get some professional advice.
Making that call is a huge first step. But then you might be thinking, what actually happens when we get there? Let's walk through the whole process, just to demystify the visit and help ease any anxiety you or your little one might be feeling.
And look at this. It shows you just how structured and gentle this whole thing really is. It all starts with a simple conversation where you share what you've been seeing. Then comes a gentle physical exam. Maybe some simple tests are needed, maybe not. But a huge part of the visit is just about guidance, talking about nutrition, feeding, and coming up with a treatment plan that actually makes sense for your child's age. It's a supportive, step-by-step process.
All right, let's switch gears and do a little quick-fire round. We're going to tackle some of the most common questions that parents have about their kids' digestive health.
First up, this is the one every new parent with a happy spitter on their hands asks. Is all this spit up something I should actually be worried about?
And the real answer is, well, it depends. A little bit of spit up is totally 100% normal. Their tiny digestive systems are still figuring things out. The tipping point is when it starts to seem constant, or, and this is the big one, if it seems like it's actually painful for your baby. That's when it's time for a checkup.
Okay, let's move on from babies to toddlers and bigger kids. When it comes to constipation, what are the usual culprits in their diet?
Yeah, the answer usually comes down to one of these three things: not getting enough fiber from fruits and veggies, not drinking enough water, or, you guessed it, too many processed foods can really slow the system down. And a lot of the time, it's actually a combination of all three.
Now here's a fascinating one. We all know stress messes with us adults, but what about our kids? Can their worries actually show up as a tummy ache?
The answer is a huge yes, absolutely. That gut-brain connection is powerful, no matter how old you are. Big changes at home, worries about school or family stress, all of that can lead directly to real physical symptoms like stomach pain or changes in their bathroom habits. It's a really important link to remember.
And now for the big picture question. This is the one that's really on every parent's mind. If these issues keep going, what are the long-term effects? So, this is the crucial point. Yes, they can. If a digestive problem is getting in the way of your child absorbing all the good nutrients from their food, it can absolutely have an impact on their growth and development. And that is exactly why getting things checked out early is so important.
This quote just nails it, doesn't it? It really gets to the heart of the matter. It's such a powerful message of both reassurance and empowerment. Most of these common issues have pretty straightforward solutions. The real key is just getting that guidance early on, before a small problem has a chance to become a bigger one.
And that's the bottom line. That's what this is all about. You now have the tools, you know what to look for, you've got a checklist for when it's time to act. And you know what that supportive process looks like if you do need help. Never forget that you are your child's #1 advocate.
So I'll just leave you with this question to think about. Now that you have this knowledge, what's one small, confident step you can take, maybe even today, to support your child's digestive well-being?